Welcome to the Front Porch. We are excited to have back with us, by popular demand, Donnie Lameth, president of Lexington Medical Center, part of Wake Forest Baptist Health Center. And Donnie, you're still looking good. You've lost a little weight, I believe.
Been trying.
Okay, looking good. Donnie, I guess it's been about a year ago since you came to Lexington, and you had a great vision. How do you describe the progress that you saw and that you've made?
Well, it's been great to be here in Lexington, and I have enjoyed it thoroughly. And time does fly when you have a good time, and I've had a great time here in Lexington. And I'm really excited about the future of Lexington. I think y'all have got a lot of things going on. Your new leadership here has a vision for the city, and I'm glad to be part of it. What has happened over the last almost a year actually has been a lot of things. We have been extremely busy at Lexington Medical Center. Our employees remain very committed to make this the very best healthcare experience of our customers and our patients and our families. We have focused on a number of things. First and foremost has been our ER. You know, the ER becomes the front door to your hospital in many cases, in many communities. And our ER has been growing. You may remember when I was here before, we talked about bringing the Wake Forest Baptist doctors here, all board certified in emergency management. They're here. They've done a great job, and I think the community has accepted that things have changed in our ED. I wished we could do some things quicker. For example, we have a very small ER, and we're looking at ways from a space standpoint that we can deal with the space constraints. And when you don't have enough treatment room space, sometimes people have to wait a little longer. I am very focused on customer satisfaction. We got to do better on our customer service responsiveness. And we're looking at ways that we can expand our ED. We're looking at ways that we can meet the customer's needs so that we can continue to grow in their ED. And so that's been a big issue this past year.
You know, I've had the chance to visit Lexington Medical Center on several occasions in the last year, and I notice an excitement with the staff. They're excited about what's going on. What are some of the other services that you've seen some progress in? Well,
the staff's a great staff, and they're very dedicated and loyal, so I want to give them kudos for what they do. And they really are what makes Lexington what it is today. We're focused on growing our rehab services. It's another great service that the community, when I first arrived, I'd ask the community, tell me what you like about the hospital. Rehab and orthopedic services there are top notch. Put them up against any hospital in the state. We need to grow rehab. So that's focus that I have, is to continue to figure out how we grow that service to meet the customer's needs. You may recall that we've added an ENT surgeon, lives here in Davidson County. His wife's part of our staff, a PA at our North Davidson practice. And they have been a big hit. He's been very busy. He'd like to see more of our friends and colleagues here in Lexington. Dr. Chapman is his name, and if you were interested in the ENT for both adult and pediatric, he does take care of kids and children. He's a great surgeon, really a young up-and-coming star in the profession. Cardiology has been a great service here. Dr. Twomley, I've had great feedback from the community about her as a physician, her style with patients, and cardiovascular disease certainly is a major issue in our state and our region, and it's one that she's been able to jump right into in her 2 years here in Lexington. The Cancer Center is an unbelievable service here, and you know, my vision for the hospital is that we keep more patients here in this community for their health care needs, rather than having to travel outside the community. And so as we begin to bring more patients services into this community, we can retain those patients to go see their doctor, come over to the hospital, use services, and not have to travel out of county to receive services that really you can get right here in Lexington.
Dr. Twomley's my doctor. I see Dr. Chapman and his family in the community when we have events in the community. Yeah. They really are part of the community, and I appreciate that. But let me ask you, from an overall picture, can you kind of give me an idea of the differences since Lexington Medical Center has been affiliated with Baptist, Wake Forest Baptist Health?
That's a great question. There are a number of differences. You know, part of what I've been trying to do is to bring more services here, and we've actually added 10 new services. You know, Dr. Twomley added a cardiac rehab program. People that needed cardiac rehab as follow-up, they would have to go out of county. Well, you can have that right here at Lexington. Easy entry into, great program under her supervision, and it's one of the great new services we've added. So continuing to bring those services that the public needs here in the community so that they don't have to travel is really one of our objectives. And that's just an example of one of the many that we've done.
Now, definitely progress is being made continuously. What are some of the new things we're looking for in this new year, 2012?
Well, we want to grow those services. We still have capacity. We're actually adding, through Davidson Surgical affiliation we have with that group, we're adding 2 new general surgeons, and we want to see more of the general surgery population remain in the community. We've had some challenges in general surgery, and this is a big change, a big improvement, as we've added 1 that will start literally next week, and then 1 that will join the Davidson Surgical Group in April. So our surgery capabilities and our ability to render care in the hospital is one of the areas we're really focused on in these next several months.
Now, I would imagine that an important engine that helps drive a successful community hospital is the board of directors. And you've got a strong board of directors.
It's an outstanding group of board of directors led by R.B. Smith, who's a longtime resident, attorney here in town, just a tremendous individual and tremendous leader. Chuck Miller was the board chair that left us this year as his normal rotation off and did a tremendous job with that board, going through some really tough times over the last several years as they were transitioning into the Wake Forest Baptist system. But we're really fortunate to add Tara Green, who's the city's finance director. We needed some strength in that area. She lives in Arcadia. Karen Craver, who happens to be a colleague school board member here in Davidson County that I've known very well for a number of years, works at Wake Forest Baptist System, lives in Arcadia, but at Denton, sort of raised and bred. And then Greg Stabler, who's the general manager of Davison Waterworks up in Welcome. And those 3 individuals will speak and represent the community well. And then, of course, from the Wake Forest Baptist System, we've added Dr. Seibert, who's the president of the clinical enterprise at the Wake Forest Baptist System.
That's a powerful nucleus you're building on there. Those are good folks, and they're concerned about what happens in their community.
Exactly.
Okay. All right. Let me ask you, Donnie, community involvement is important to you, to your board, and to your staff, isn't it?
Absolutely.
You did the lunch and learns. You take it literally to the streets. You give it to the community. And
we will continue to do those. We're looking at ways that we continue to strengthen the relationship with the Y, which has a great following here in this community. Obesity in this community is, in the region really is a challenge for all of us. And we're looking at ways that we can address that through our MEN program, which helps the adolescent that have some weight issues. And then more recently participating with the Y on this Transformation Nation, which is a regional opportunity for individuals to go through a fitness weight loss program.
Anything concerned with community wellness, health, emergency needs, I'm hearing you say that anybody that lives in our community can count on the Lexington Medical Center to meet those needs whenever they need them.
Yeah, we're actually doing a community health assessment with Thomasville. This is a cooperative venture with Thomasville and the health department here in Lexington. And you'll hear more about that as we get into that, but it will be a pretty broad assessment of the health of the community. And it's a nice cooperative venture between the 2 hospitals and the community.
Everybody wins.
Everybody wins.
Particularly the community. All right. Let me ask you here finally, what do you see in store for the future?
Continue to expand the programs, but one of the things I'm really focused on right now is space.
Right.
Lexington has grown and needs more space. We're actually looking at a campus master plan. It's a wonderful campus there, nice setting, but we don't have enough space. We've had to move some departments off-site to free up some space for clinical. And over these next several months, we will be doing a comprehensive campus master plan, looking at all our needs, where would we build new facilities, and actually we're going to have some pretty exciting announcements over the next couple months about expanded programs, which will necessitate that we add more space to be able to accommodate these new programs.
That's kind of a good news. A good problem to have so much service. We need more space. Well, it certainly has been obvious that Wake Forest Baptist Health has really, really committed to be a part of the community here at Lexington Medical Center. Donnie, will you come back and update us regularly?
Give me a few months when we already announce some of these exciting endeavors. I'll be glad to come back and talk a little bit about those.
That would be perfect. All right. Coming back, more good news right here on the Front Porch.